So I guess one of those COVID babies that will always be associated with what we're going through. Uh, Alex does a lot of work for us at the Cancer Center, providing mental health counseling for cancer survivors and family members. Tonight, he's going to give us a talk about how to set boundaries with your loved ones. And so without further ado, I'll turn it over to Alex.
Okay, thank you so much, Dr. Deming, and Chris, thank you as well. I'm very privileged and honored to be able to speak with you all tonight. You know, this is something I've been doing for the past several years now. It's near and dear to my heart, just having lost my grandfather to cancer. And so this is always something that I look forward to being able to do. As Dr. Deming said, today I'm going to talk about something that is a very difficult experience that I'm sure many of you have gone through, and that's trying to figure out and navigate, how do I set limits with members of my family? And, you know, honestly, the skills we're going to talk about today will go beyond just family. It has to do with setting limits with coworkers, with friends, with, you know, the nosy person at church who wants to know your business. This is going to be something that I think will hopefully be informative and help you to navigate the hows of having those conversations. And so, as we get started today, I want us to just think about boundaries in a general sense for a minute. Okay, so I'm going to ask you first to just imagine that you wake up in the morning at 5:30. Some of you might get up sooner than that, some later. But let's say you get up at 5:30 in the morning and you go to, you know, go through your regular morning routine, maybe make a cup of coffee, and then you walk to the window, take a look outside, see what the weather's like. Unfortunately, it's been really hot lately, so it's probably nice that you're inside. But you walk to the window and you look out, and your neighbor next door is digging a big hole in the center of their yard, about 6 feet wide, maybe. And you just look and you think, I wonder what that person's doing. I have no idea. Right? They don't have anything else there other than themselves and the shovel. So we always wonder, what is that person doing? And we might be inquisitive and we might want to know. Let's change the scenario a little bit now. Let's say you wake up at 5:30 in the morning, you grab your cup of coffee and you go to the window and you look out, and the neighbor is digging a 6-foot hole in your yard now. How does that change the questions that you have? Probably it's probably fair to say you're not going to be too pleased about this new 6-foot hole in the middle of your hopefully pristine yard. But it changes the way that we interpret those actions. Okay. Now let's think about a slightly different scenario. Let's say that with that pristine yard that you keep, you have the yard that is kind of the prize of the neighborhood. And you look over at your neighbor's yard and it's unkept. Weeds everywhere, grass, you know, almost up to your knees. And as you're outside one morning or one afternoon, you see your neighbor come out, and your neighbor is beckoning your attention. And your neighbor stops and says to you, hey, when are you going to come mow my yard? And you think that that person's kidding. But in reality, this time they're serious. They really expect you to come and take care of their responsibility, something that they own and are responsible for. And realistically, that is what boundaries are all about. Boundaries are all about figuring out how do we navigate the intricacies of what do I own, what am I responsible for, what do other people own, and what are they responsible for, and how do those responsibilities interact with one another. And that's what we're going to look at a little bit today. Okay, so we're going to go ahead and jump in to things, and I'm going to be trying to use the whiteboard here. So bear with me. I'm just as new to figuring out all of this technology as I'm sure many of you are. So let me see if I can share my screen here. Okay. All right. So we're going to start with the notion of what things we do in fact own and are responsible for, because I think that's kind of the basis of any boundary that we're going to set. We have to identify what those things might be. And you'll notice that I've used a circle with the word me inside, and that is obviously to represent you as an individual. The reason I think circles are particularly good as far as kind of depicting that boundary, you know, think about any time somebody has gotten too close to you, physically speaking, and we think of, wow, you're stepping inside my bubble, that nice round bubble. So that's what the circle is all about, okay? But if we think about what kinds of things are we responsible for? The first thing that might come to mind is our thoughts. We are responsible for our feelings. We're responsible for our actions and our choices. We're responsible for our belongings. We are responsible for our health. We are responsible for how we treat others. We are responsible for so many different things. And the obvious one that I think a lot of people think of is the possession side of things when we talk about ownership and responsibility. But a lot of times it is the more emotional pieces of this and the thought piece of this that start to become blurred, especially when we start thinking about our responsibilities to others, like how we treat them. Some of us might have children, and now those obviously fall within that bubble of control and responsibility. We could go on and on, creating a really lengthy, long list of what these responsibilities and things we own look like. And for each of us, those are a little bit different. But what is most important about understanding boundaries is figuring out how the types of boundaries we have, just maybe naturally, can cause us problems and can be something that we have to try and restructure, especially when they are not necessarily maybe the healthiest. So we're going to look at a couple of different examples here now. Oh, and I look at all of those errors. What a wonderful sight. We're going to hope that maybe this will work, and if not, we are going to just start fresh. Let's see. Okay, perfect. Hey, that wasn't so bad. I think we'll be all right. So the first type of boundary that we sometimes see is often referred to as open or diffuse. Okay, now with open boundaries, it's a lot like you see here in the picture, where the boundary isn't a solid line. It's almost dashed. And the problem with having such open and loose boundaries, where we're not willing to maybe kind of enforce limits with other people, or we ask for people to do too much for us and we don't do enough for ourselves, is it gives people then the opportunity to step into our bubble, right? And in some cases, that's not such a bad thing. In some cases, when we need assistance, when we need help, having the ability for people to step in is a really good thing. But when there is no limits to how and when they step in, that's when it becomes problematic. So you can think about times where people enter your bubble as situations where people might tell you what to do in a given situation, or how to think, or what not to do. Sometimes equally problematic with having open or diffuse boundaries is not just that people can step in, it's also that we sometimes try to step out and step into other people's bubbles. And that can be, particularly precarious position to be in, because sometimes people aren't going to appreciate you trying to step into their bubble. And I think the other biggest problem with you stepping into someone else's bubble is it really prevents them from taking ownership and taking accountability and being responsible for those things that they truly are responsible for. Okay. Now, this is just one of a couple of different types of boundaries, but we would consider this form of boundaries to be relatively unhealthy. It can lead to certain negative qualities like enmeshment or codependency with others. And again, it just facilitates a lack of ownership of those things. So let's take a look at another one here, and hopefully we will get just as lucky as we did last time. Okay, so let's look at the next type of boundary that we sometimes see, which is often referred to as, well, that's a terrible O, but it's closed boundaries. Okay, so these are closed boundaries. This can also sometimes be referred to as being emotionally cut off, and this isn't necessarily the thing that always follows somebody who has boundaries that are too open or too diffuse. But it can, because sometimes when we get tired of people kind of telling us what to do, when we get tired of people putting their nose in our business or kind of stepping into things that they realistically don't have a spot to be in, we sometimes have these negative reactions. We push back, and we sometimes push back in ways that create more problems. Typically, if someone feels like they're just trying to help and you bite their head off in their mind, it's going to make it less likely that they're willing to try and assist in the future. And it also just kind of creates this general wall. I'm going to kind of draw a wall like this, so that it's a good thing in that it's protective of people trying to invade, but it also makes it impossible for us to pull that assistance in when we want it or when we need it. And it also makes it very difficult for us to kind of step out and to be helpful to others. So both open boundaries or diffuse boundaries and closed or emotionally cut off boundaries are really not helpful in getting our needs met, and they make it very difficult to just function in healthy ways with others. Let's take a look at the next one here. And this one does not have necessarily an interesting name. This one is often referred to just as healthy boundaries, okay? And I've kind of drawn a picture here, and I usually ask people in the group, what does this look like? I get Pac-Man a lot and some other goofy things, but the part that's different about this circle, and for anybody who's ever looked at blueprints of a house or a building may recognize, this dashed line and solid line across as being what you would find in a door, right? Because essentially that's what we want. We want to create a door that can be opened, that allows people in, and it also can be closed, for things that we don't want others stepping in on, right? It also gives us a good recognition and a door for, should I be stepping in or should I be stepping out and into someone else's circle, or is this something that they need to be responsible for themselves? And you'll also notice there's this little kind of hash right here. That's a goofy way of trying to draw, a peephole in a door like you see in so many doors. Because essentially we want to be able to assess each situation by its merits and individually to determine, is this something that I should be stepping out into, or is this something that I should really be allowing this other person to own? So those are the three kind of main types of boundaries that we see. And ultimately, the reason why having these healthy boundaries, having this door is so effective, just to kind of reiterate this, is it ensures that we can get the assistance we need when we want it. It allows us to own the things and be responsible for the things that we don't want assistance for. And it also encourages those same behaviors in other people. All right, so this is why healthy boundaries are such a helpful thing in navigating our relationships with other people. Now, if we think about some of the kinds of boundaries that we might have to set as patients or as family members of patients, sometimes we have to set limits about and boundaries. I'll use limits and boundaries kind of interchangeably. Sometimes we have to set those limits and boundaries regarding the things that we can do for someone or not. This might be whether or not we can transport someone to all of their appointments or be present for all of their appointments. Doesn't mean that we don't want to necessarily, but it means that sometimes we have other responsibilities that also require our attention, and maybe we are not capable of doing all of it. Maybe it is in terms of a treatment decision that has to be made. And, you know, oftentimes when patients have those decisions that have to be made, they hear from their families a lot about what they think the person should do. And it's not that we don't want to necessarily hear those opinions, but ultimately that treatment decision has to be that of the patients themselves. So again, that's where we can invite in maybe you know, those perspectives. We can invite in those other people to share their thoughts, but ultimately we can have them close that kind of boundary door, and then make a decision for ourselves. Sometimes we have to set boundaries and limits with our doctors, with our you know, with our care team, and it's not in a "I know better than you" doctor or nurse or other helping professional, but maybe it has to do with knowing ourselves and what we are willing or are not willing to do. Sometimes that it requires a limit or a boundary to be set. We could continue to kind of expand upon all of the types of boundaries or limits that may need to be set. But ultimately, what we're going to have to recognize is that the limits that need to be set are ones that you will decide. There is no right or wrong about, you know, kind of universal truths about this is a boundary you should absolutely set, or this is a boundary that you shouldn't set. These are things that you will have to decide on a case-by-case basis. But I think sometimes knowing how to do that, how to set those limits or boundaries, will give us insight into, you know, which ones we actually need to set, okay? So let's take a look at the actual process of setting a boundary. Now, I'm going to use just a kind of a random example of what boundary I would potentially need to set. Let's say that, and this is a made up example. I should have had one prepared so that it's not made up on the fly. But let's say that me and two of my colleagues at work are kind of in a close group, right? And let's say that the two other colleagues end up having a falling out of some kind. And so let's say that one person wants to come into my office frequently and complain about the other person. Or badmouth the other person in the break room or what have you. If that makes me really uncomfortable, because I don't want you know, other people to witness that and think that I'm talking ill of this other person, because obviously I have a relationship with them, or maybe that's just not how I choose to operate. That's probably a good place for me to set a boundary with them, because when we feel uncomfortable, when we feel like we're being pushed outside of that comfort zone, that's usually a place and a time where we have to look at setting a boundary. So let's go ahead and kind of look at the steps of how to set effective boundaries. Okay. I'm going to try and zoom in here just a little bit. There we go. Okay. So the very first thing, and there's only 3 steps to this. I know a lot of times people think that boundary setting is pretty complex, or that it can be, you know, complicated to figure out, you know, what do I have to do to make this work? The truth of the matter is, it only takes 3 steps. Now, it is also very fair to say that simple is not synonymous with easy, okay? So when we set some of these boundaries, the steps themselves might be simple, but the process of actually following through on it is very challenging. Okay, so the very first thing that we have to do is we have to identify what is my boundary, okay? What is the boundary? What is the problem that needs to be addressed? What is it that I'm uncomfortable with? What do I want to have be different in my life? Now, one very, very important thing about boundaries that I think is just so important to understand. When you set a boundary with someone, you are not limiting their behaviors. You are not forcing them to do something that they don't want to do, right? We're not controlling them in any way. Essentially, when we set a boundary, we're setting a limit about what we are willing to accept in our own lives, okay? I'm gonna say that again. So we're setting a limit about what we are willing to accept in our own lives, okay? And I'm gonna walk through the example, another example as well, that will hopefully highlight that point, okay? So let's use this example. Let's say that some parent has a son or a daughter who has issues with addiction. And that person is oftentimes wanting financial support from their parents to get food, or to have a place to stay, or whatnot. Obviously, as those parents might recognize, continuing to give money to someone who has issues with drug addiction is often a form of enabling behavior, because even though we may not be providing money that person is using to purchase drugs or purchase alcohol, it is enabling them to continue spending what other money they do have on those substances, rather than on the things that they need for their everyday lives. So the boundary there might be that, you know, son or daughter, we are not comfortable giving you money while you are actively using substances, right? Or while you are using drugs or alcohol. You'll notice in that boundary, the parents didn't say, you have to stop doing drugs or alcohol. All the parents essentially said was, we are no longer going to give you money if you are using substances, okay? So it's very different than saying, you can't do this. It's, we're not doing this if, you know, situation X is going on. Okay, so we first want to identify what the boundary is. That's the very first and important piece of this. The second thing that we want to do, we want to deliver the boundary or express the boundary with a neutral emotional tone, okay? Oftentimes, when we go to set boundaries or limits with people, we do so in a reactive way. So either something has just happened, they've just said something or done something that upset us, and so we launch into a conversation about, you need to stop this, you need to not do this. And oftentimes when we do that, when we do it in an emotional or a reactive way, first of all, we don't set it clearly in a way that other person is going to necessarily understand, or that other person might interpret the emotionality that we have as being something that is situational. It's only because this person was upset about it, or it's only because this person was in a bad mood that day that they meant this. It doesn't actually mean it, that this is how it's going to be forever and ever, right? So when you express the boundary through that kind of neutral emotional tone, you also want to express what the consequence of that behavior is going to be, right? So if we go back to our example before, you know, we look at the example of the parents with a son or a daughter with addiction issues. The boundary is, we're not giving money if you are continuing to use, right? The limit, the boundary itself, the quote unquote consequence of that said action is no financial support. Okay, so we want to make sure that we've identified the boundary, we express the boundary in a neutral emotional tone, and we want to make sure that we are providing very clear behavioral expectations if we are not to have to enforce that. Okay. And then number 3, we said there was only 3 steps. So the third step with this is that you have to enforce the boundary consistently. If you do not enforce the boundary every single time with consistency, it is kind of, I liken it to training a dog not to jump on the couch, okay? If, let's say, you have set the rule for your home is that the dog is not allowed on the couch, and every time the dog jumps up on the couch, you push the dog down and say, no, you're setting an effective boundary. But let's say that that dog jumps up the next time and you say, oh, it's okay, right? Or, oh, you're being a naughty boy, but you don't actually enforce the boundary, then all you have done effectively is identified for that person, oh, they don't actually mean this, right? And then they can start pushing back on the boundary or the limit more and more and more. And so essentially, by not enforcing it, you're creating additional work for yourself, and potentially additional conflict. Because what I can guarantee you is when you go to set new boundaries with someone, you're going to likely get some pushback. Whether we're talking about something that's highly emotional or not, we are status quo beings, right? We like homeostasis. We like to stay the same. And whatever type of arrangement we have navigated in a specific situation, we tend to like to keep it that way and not do much about it. So ultimately, you're going to get that pushback when you go to try and set that boundary. But as long as you stay consistent and as long as you go back to kind of that neutral emotional tone and you express the boundary as the limit that you're setting, then that person will eventually start to get the picture. They will get the idea. And so, though this is a very simple set of steps, right? It is something that does not take a tremendous amount of insight to be able to do. It does require a lot of effort. It can be very challenging, and it can be an emotional thing, especially when we pull in the emotions of other people. But ultimately, what you have to do with this is you have to go back to kind of the reason why you're setting the boundary in the first place. And that is knowing that no matter what guilt that person might try to lay on you, no matter how that person might try to point out what they feel is illogical about the limit that you're setting or isn't fair about the limit that you're setting, that you're not forcing anyone to do something. You essentially are just saying, this is the limit I'm willing to accept in my own life. And that's what effective boundary setting is all about. Normally, when I kind of give this talk, there would be, some opportunities to discuss this in person. And I don't know, Dr. Deming, Chris, if you're still there, if we can open that up to the group for questions about, any specific forms of boundaries or challenges that maybe people have recognized in their own experiences in trying to set limits with people.
Hey, Alex, can you hear me?
Yes, I can.
Yeah, so I think, and Chris, correct me if I'm wrong, but I think the way this particular Zoom meeting is set up is that the participants can only ask questions via the chat box. Is that
Oh,
correct,
okay.
Chris? I think this is set up with the audience not able to actually speak. So
Okay.
there's a chat box at the bottom, and Chris
Gotcha.
is monitoring that as well. So.
Okay.
And Alex, repeat the question that you would like people to respond to.
Yeah, so the question that I have is if anybody has experienced any difficulties in trying to set limits or effective boundaries in the past, or if maybe they've had success in doing so, and if so, what really worked for them, or what was helpful or most helpful?
Well, I'll start with one that came to my mind. It was when I was hospitalized during my cancer treatment. I actually had to tell people it was okay for them to go home because I had friends that would come, particularly like before work, for example, and they'd be sitting there and their phone would be dinging with emails and text messages from people at work, and they wanted to stay and be comforting, but at the same time I could feel their anxiety level increasing, and so I would just politely give them permission to go ahead and, it's okay if if you need to go. I'm going to be here. You can come back and see me. So that
Right.
was not necessarily confrontational, but more sort of an invitation for them, because I could see that it was something that was sort of taking over their attention span for sure.
Yeah, and I think you bring up a great point. Is I think sometimes what feels confrontational about setting boundaries with people is that we are often doing it before we've taken the time to fully think through what that limit or boundary is. And so it comes out in that kind of almost forceful or emotionally reactive way. And that usually is not well received by others. But, typically if you stay kind of more calm with things and you can just, kind of be direct in that way, it tends to be received, a lot better. And I like that you were, able to identify both something that was probably making them anxious, but also kind of was making you uncomfortable. And by being willing to say that and speak that truth, everyone was able to kind of get what they needed in that moment. Yeah.
Yeah.
Alex, you mentioned the word direct, and I just put in the chat box. I think that's the most important, is just to be direct, even if it seems awkward. So that's one method. And the second method would be to enlist the help of individuals that are very close to you. So, if it's somebody that just isn't getting the message, or someone that you just feel you're on the borderline of hurting their feelings, you can get someone that's really close to you to speak to them and say, we really appreciate your support, but Chris would never say this, but he's really needs a little bit more time with sleep and rest. And he always is just welcoming to everyone, but he needs more space. And so could you just help out in that regard? So I think that one removed way of is having a messenger give the message can be a little easier sometimes.
Absolutely. And and Dr. Deming, that's a great point. It's a great example of what we were talking about before with the door, and being able to open the door and say, yeah, I could really use some help in setting this limit. Whereas, if you were having to express that conversation to a very, very close loved one, whether it's, a spouse or a sibling or a son or a daughter, you probably wouldn't want somebody else stepping into that position and trying to set that limit. That would be something that you would want to do yourself. And so that's really what effective boundary setting creates for us. So it's not necessarily that we're going to be able to create this overnight. Sometimes it's going to take a lot of work. And, you know, it's good to start with something small. If you got like have a laundry list of things that you really want to set limits on, start with the easiest one. Start with what feels like the smallest, like, you know, least challenging thing for you to do, and start there. Because when you kind of get on a roll with setting limits, you start to grow in your confidence to do it effectively. And also you grow in your confidence that the way you're going about it will not necessarily elicit, you know, super negative reactions, because you'll be doing it in healthy ways. Absolutely.
I think the other thing that popped into my head was the use of mechanisms or communication devices like Caring Bridge, for example, where you can say, I mean, you can't say to somebody, stop giving me advice about, you know, about drinking asparagus juice, or don't tell me that I got my cancer from Bounce laundry detergent, you know. But you can say things like Dick was just saying, you can say, you know, Craig prefers to have visitors from 1 to 4 in the afternoon, or, you know, please try to limit your visits to 20 minutes, or, you know, as much as we would love to have you stay in, you know. And again, those are an opportunity where sort of that third party, or your second, if you will, would be able to, whether that's a parent or a sibling or a spouse, or maybe even your child, depending on your age and your cancer situation, just to sort of post the rules, so to speak, on something like Caring Bridge. And that also eliminates the sort of resharing and continuous sharing. You know, you mentioned the lovely people at church, you know, that really, you know, I haven't seen you, are you okay? Now somebody told me that, you know, and boy, it just starts you to boil if you don't really set the boundaries just as you've outlined.
Yeah, Chris, that's a great point. You can set boundaries with multiple people through something like Caring Bridge, and yeah, you're not going to do it in again that aggressive, reactive way of like, well, don't tell me it's this. You're going to, you know, put it out there as this is the limit that I need to enforce or need to put out there, and so. That is, again, I think if we go back to that list of steps, right? Step 1 is identify what the boundary is. To identify what that boundary is, it really requires that you take some time to think it through before you try to, you know, kind of share it with someone else. Because it's typically when we try to do that in the moment that we either end up saying something that we don't actually mean, that isn't the limit we're actually trying to set. Or, as I kind of mentioned, it creates the opportunity for them to think of this as something that they can dismiss because it was only expressed through something that was, you know, very, very emotional. It's kind of like if you have an interaction with someone and you blow up on them, right? Or you kind of, you know, maybe even if you don't blow up on them, if you just kind of walk away, what is going to be memorable in their mind is if you come back a few days later in a very calm way and say, hey, I wanted to talk to you about this because this really upset me. That is going to resonate with them as, oh, this is something that this person was thinking about. This is something that was important. And so it's the same thing with boundary setting. We don't want to do it right after something happens. We want to take the time to think that through. And that's how we avoid, you know, kind of those sharper, you know, ways of phrasing it.
Yeah, I think, and that sort of tied up in that number 1, as in my mind, was it's okay to have boundaries. You know, some people think when they're sick that they need to be this open book, and frankly, they just don't. You know.
Yeah. Oh gosh, it makes it creates a lack of privacy. That's kind of why we draw it with the dashed lines, right? Yeah. There's no privacy. You can't hide behind the little tiny section of the wall because people can just come right around the other side and take a look in. So when you create these types of boundaries, when you set these limits, whether with one person or with many people, you create the space for you to be back in the driver's seat, for you to make decisions about what happens in your life, how you handle those things that, again, you're ultimately responsible for, those things that fall within your bubble and your circle. So, yeah.
Yeah, this is really good.
Well, thank you. Yeah.
To me,
Does anybody
I
else?
love the simplicity, and but yeah, I love the phraseology that you said. Because it's simple, that doesn't mean that it's easy.
Right. Yeah.
Because particularly when
Unfortunately,
we're
it'd
most
be nice if it
vulnerable.
was.
Yeah,
Right.
and
It'd
when
be
we're
nice if it
most
was.
vulnerable and when we're sick and we don't feel well and we're already sort of putting on the best, best front, if you will, for some people, whether it's in
Yeah.
your home or in the hospital situation as a cancer patient or a cancer survivor, you do sort of want to be the best you can be. But sometimes I really like the simplicity, but the really sort of good sense that your 3 steps have provided. It makes complete sense.
And I think, like you said, it's, even though it might be work on the front end, it might be hard because you're just trying to get by in the moment. What I can say with a fair amount of certainty is that by setting those effective limits, you are going to be eliminating sources of stress that are already above and beyond what you need to deal with in that moment. So it's kind of like paying your dues to not deal with as much later on.
Right. Well, and the last thing that I thought to share was it can also be it was sort of a relay of information. If you say to your very caring aunt that we're trying to not talk about that subject, or I just can't take any more nutrition advice from people, and then I just sort of can hear that person in the hallway at the hospital or on the phone with somebody saying, well, he told me that he doesn't want to take advice, and they can sort of relay that information because you were confident enough or felt positively enough about your relationship with that person that you shared that with them, and they can turn around and sort of be the expert, if you will, and share it with others. I can definitely see that that's happening.
Absolutely, for sure. Yeah, it definitely pays dividends.
Yeah, absolutely. Well, this is great. Do you find that people, when you deal with patients, is this one of the number one things that they talk about, is sort of the intrusion of other well-meaning and well-care and much caring others?
I actually honestly would say that boundaries are probably one of the most frequently required issues of all people, whether we're talking about cancer patients or members of families with a patient who has cancer, or the everyday general public. Right. It is probably one of the most needed things. I think we would all be, I think, a lot healthier and a lot happier in our relationships if we started establishing some of these boundaries more effectively. And I think the biggest reason why it doesn't happen is because it is hard. It's hard to do. But I've had so many, both cancer patients and non, who have worked at setting these boundaries, and they found themselves being much happier on the back end of it all. So absolutely, yeah.
Well, this has been great. Alex, we sure appreciate you being part of the Cancer Education Series tonight. And
of course, thank you so much.
If people have individual questions or if they want to seek your good counsel, they can find you on the Mercy website, right?
Yes, they can.
On the MercyOne website. So find Alex there if you want further good counseling in this nature. So thanks again. And as I mentioned, we are recording this and it will be on our YouTube channel. Dr. Deming, any final comments?
No, well, yes, I do have. As I mentioned at the beginning, Alex is available to provide mental health counseling to cancer patients, survivors, their family. And it's really a great benefit. I think during the COVID situation, a lot of Alex's initial visits with patients are via Zoom. So that's also a possibility. So you can reach out to Alex directly, or to me, or to your navigator or your cancer doctor, and we can help get you connected with Alex. Thanks again, Alex, for the talk tonight. Yes. Thanks everyone for participating, and it's great that we've got this set up so that we get to post it on our website, and it's available for others who weren't able to join us live tonight. So thanks, Alex.
Of course. Thank you so much, everybody.
Take care. Thanks again.
Good night.
Bye-bye.